Hello, everybody. I'm recording this on the morning of Saturday, September 12th. A little while ago, the Minister of Health in Ontario posted some statistics from yesterday's testing for COVID-19, and cases continue to rise. I have updated my Power BI reporting of there's very little manipulation of data by me. It's just takes government feeds of data and presents them. So I wanted to discuss that and maybe use today to give some context to the tools in my report. So before 10:30 every day, the minister posts a tweet and usually gets responses like a couple of examples here. One person says, "Oh my God, it's just getting worse and worse," and has emojis of crying faces. Another person says, "Hoped all those people enjoyed the weddings and the strip clubs." So let's dive into the data and see where it's rising and what the impact is. This is the main page when I open it, and I'll share this link, but you can find the link yourself there or share this on these sites. So basically, I try to put enough on a page you can get a quick idea what the graphics are, but more and more I expect people to go into what's called focus mode if they really want to see a trend from one of the visuals. And here you've got two things going on. On the orange, you've got the deaths on this axis, and it's 1. Yesterday it was -1, which tells you the data's not perfect. You do get a pretty good sense of the rise in new cases from this graphic. So two things. If we go back to April, I got in a bit of a spat with a UAT epidemiologist for claiming deaths was the main stat. And they said, no, the main stat was people in intensive care, because it showed the pressure on hospitals. So this is the graphic for hospitalization, people in ICU, and people in the ICU on ventilators. Now, aside from noticing how down it is from when we were ordering 10,000 ventilators because we were worried about using the 2,000 we have, to where we've got 8 people on a ventilator, you'll also notice that over the last 30 days of those rising cases, there's not really any perceptible rising strain on the healthcare system. And this one should help to explain why, and the minister mentioned in a tweet today, how much of the positive tests are now in young people. So if I go back to April, and this is why I use this filter so we can do this, you'll see the distribution of positives. There were 11% were in their 20s, and 12% in their 30s. And the second highest concentration were people in their 80s. And all the deaths occur, well, most of the deaths occur up in the 70s and the 80s and 90s. If we go to this month, you'll see most of the cases, well, not most of the cases, the highest percentage group are people in their 20s. And people under 30 are 48%, and people under 40 are 65%. And the number of deaths in that group is 0 this month, but it's also 0 last month, and it's 0 the month before that. And this month it actually shows 1, but that person in the health unit said did not die of COVID. So it's actually been 0 for all that time. So this is really one of the big reasons you're seeing a a change in cases without a change in fatality. But it's not the only reason, which is where I've graphed this graph, which you may have seen on Twitter, which is the percentage of people who tested positive who have an outcome of fatal. As a ratio to the total percentage of people who tested positive. So you see the decline in people in their 90s, but it's even more so in their 80s and quite a bit in the 70s. Some of this is maybe due to an element of time. Maybe people who contracted it in August will not recover. But it seems likely there's a lot better medical outcomes now as well, aside from the age is shifting. So here's a number that would be really deceptive now, which is the case fatality rate. And you'll see this one in our World on Data and some of the better sites that just report data. So you could say that case fatality rate in Ontario is 6.4%, which is, quite high. But if we go back here and we look at over the last 3.5 months, the case fatality rate is under 1%. You really had, it was coming down in May, it was 12.2% in April, and I should say the dates on here are when we think people, is what's recorded as an accurate episode date, which is the date they believe the virus was contracted. And then I've showed this a couple of ways, and hopefully this graphic will explain it. It just again shows when things were really bad, the most tested group during the crisis in retirement in long-term care facilities was people over 70. In the 70s, 80s, and 90s, right? Now, by far, the bulk of the positives comes in people under the age of 40, where the outcomes are basically, they're non-fatal outcomes. So, the increase we're seeing is in that demographic. And that demographic is not stressing healthcare systems and is not seeing fatalities. One last thing I wanted to point out, if I click on this, I can sort it by number of tests, and if people want one iota of good news from the release of statistics for September 12th, is that's a record number of tests completed for a day. So we are testing, we are finding positives, we're finding them in concentrated in the least vulnerable part of the population, and we're not seeing any strain on our healthcare system.